We are once again joined now by Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health, to talk about COVID-19 as always. And Doctor, we always appreciate your insight and your time. There's this viral social media post out there claiming a recent update on the CDC's website shows that only 6% of people died only from COVID-19, while the other 94% of deaths involved contributing underlying conditions. So a lot of people are saying those numbers show that deaths are lower than reported. So can you explain the CDC update and what these numbers indicate?
Okay, Maria, so I don't really think this is very new information. We've said all along that the majority of deaths in the United States and globally are in people who have chronic conditions and often are elderly. And the younger patients tend to have chronic conditions. So what it showed is that the majority of the deaths, 94% of COVID deaths, also had chronic conditions, not just a single chronic condition, but on average, the people who died had 2.6 chronic conditions like diabetes, like chronic heart failure, things like that. So the point is healthy people without chronic conditions are rarely dying from COVID-19.
So let's talk about contact tracing, Doc. It was touted by both state and federal health officials as a way to help contain the spread of the virus, but there was criticism from some health experts that the U.S. is failing at tracing compared to other countries. So what is the truth? Is that the case?
So Ed, contact tracing is extremely important, okay? As you know, you hear about the test, isolate, trace. So this is that third of the mantra that we use. And what that means is when we see patients who are positive, we have to figure out how many of their close contacts, meaning being within 6 feet of them for greater than 15 minutes within their period of infectivity. And then you want to reach out to them. The problem is, if you're in Texas and you have 15,000 new cases a day, on average, these infected patients have about 5 or 10 close contacts. So imagine that. That's 150,000 people a day that these tracers have to reach out to. And there are issues with that. The phone rings. A lot of people don't answer the phone when it's a number that they don't recognize. One thing that the tracers have done in Massachusetts, and I really have to give them kudos, is that they've actually added Massachusetts contact tracer team. So they know that this is a team. When you pick up the phone, whether you have caller ID or not, that label comes up. And that has improved our percentage that have been picked up. But it is a constant issue. Also, there's mistrust and politicization. All of those things make it challenging.
Yep.
So many things to talk to you about, Dr. Todd Ellerin, but we have run out of time. We always appreciate your time.
Thank you, guys.
Great to see you, Doc. Be well.